Hello. Today we are going to look at aggression and management of a patient with aggression. Okay, so in looking at this topic, we are going first to define what aggression is and then also look at some of the things to consider when managing a patient with the aggression. So, To, to begin with, aggression refers to behavior that is intended to cause harm or pain. Or aggression can either be physical or verbal. So now, when you're talking about aggression, we are looking at any type of behavior that can cause either physical or emotional pain or emotional harm. And we are still emphasizing that aggression can either be physical or verbal. All right, so on the definition of aggression, we are saying it is a behavior that is intended to cause harm or pain, either physically or verbally, either psychologically or emotionally. Okay, now let's look at characteristics of aggressive behavior. So, aggressive behavior is communicated verbally or non verbally. When you're using abusive words, you are being aggressive. When you enter into someone's physical space and displace that person, you are causing physical aggression. So aggressive people may invade the personal space of others, so that it will cause physical aggression. So they may speak loudly and with greater emphasis. Okay, this is in order to undermine the contribution of others, so they will speak highly and make a lot of emphasis so that what they say has to be followed. So that's what aggressive people will do. So the other characteristic of aggressive people is that they usually maintain high contact over a prolonged period of time so that the other person experiences it as an intrusion or feels uncomfortable. All right. And then the other characteristics of aggression is that gestures may be emphatic and may seem threatening. It's like they point their finger at the person they are talking to, they shake their fists, they will stamp their feet or make slashing motion with their hands as if they want to slap you. So aggressive people will be talking like that as if they want to pick a physical fight. So in terms of gestures, they have emphatic gestures. Then, in terms of posture, the posture is erect and open. Aggressive people lean forward slightly towards the other person. So, this is a sign of trying to maintain dominance in a conversation. So, they lean forward. So, the overall impression is one of power and dominance. Okay, so now let's also now appreciate the types of aggression. So the types of aggression can just be three for the sake of our discussion. Okay, so there is instrumental aggression, there is hostile aggression, and there is relational aggression, like IRH. Okay, so those are the types of aggression. Now let's understand these types of aggression, starting with instrumental aggression. So this is a type of aggression that is aimed at obtaining an object, privilege, or space with no intent to harm the other person. Okay, so in this type of aggression, a person is going to aim at obtaining an object or a privilege, okay, from others, grabbing it from others so that it is theirs. Okay, so now instruments, so we mean obtaining what? An object or a privilege. So that is to do with instrumental aggression. Okay, it is aimed at obtaining an object, a privilege or space with no intent to harm or that is the other person. So that is what is in instrumental. You just want to take up someone's space or an object. You just grab it because that is what you want. That you feel is yours. And the other person should do, not necessarily fight back, because you necessarily mean no harm, but you want to get what you feel you deserve. All right. Then, when you talk about hostile aggression, this intends to harm the other person, such as hitting, kicking, or threatening to beat up someone. So, in this type of aggression, this is where a posture of fighting, okay, a posture of trying to throw punches, a posture of trying to slap the other one. So, that is what we call hostile aggression. So, in hostile aggression, there is intent to harm another person. Okay, so when you compare it with instrumental, there is no intent. You just want to get the object of privilege. Now, there is also the third type of aggression, which is known as relational aggression. So this one is a form of hostile aggression that does damage to another peer relationship, as in social exclusion or rumor spreading. So in relational aggression, there is rumor spreading and there is destruction of a peer relationship. Okay? So it may bring about social exclusion. So these are the types of aggression. Instrumental, no intent to harm the other, okay? And you get an object or a privilege. In hostile aggression, there is intent to harm the other and gesture of fighting, kicking, or threatening the other person is there. Then in relational aggression, it's a form of aggression that does damage to a peer relationship. Okay? All right. So now, what are the predisposing factors to aggression? So one of them is genetic factors. So there can be genetic factors that can be inherited, because maybe the father was a bully or aggressive. Children may take up those traits. Okay, then psychological factors, whereas someone psychologically they feel they need to dominate. So psychological factors will take place where this person will now assume a certain a privilege object or anything, because uh, they feel they deserve it even when they do not meet the criteria. All right. Then the other things are social factors. The area you are being brought up from. If there is a lot of aggression, you may fail to distinguish between good behavior that do not have element of aggression and bad behavior that may constitute element of aggression. Why? Because of the social factors or the people that you are socializing with. Then another one which is similar to social factor is environmental factor. So environmental factor that is in the area, talking about the area where you are brought up from, and if you do not realize certain things that are abusive or aggressive in nature, you may tend to absorb them. All right. So now let's look at the nursing process in aggression. So nurses provide care for patients with many types of problems. People who enter the healthcare settings are often in great distress and exhibit many maladaptive coping responses. So, nurses who work in the setting, such as emergency rooms, critical care areas, and trauma center, often care for people who respond to events with angry and aggressive behavior that can pose a significant risk to themselves. Otherwise, other patients and healthcare providers also need to learn that aggressive behavior may traumatize the patient. So, thus, preventing and managing aggressive behavior becomes an important skill for all nurses to have. Okay, so the safety of the patient, clinician, and other potential intended victim is more of most important while looking at aggressive patients. So the doors should be opening outwards and not be lockable from inside or capable of being blocked inside. So while working with impulsively aggressive or violent patients in any setting, one must take care to reduce accessibility to patient of movable objects as well as jewelry and other attire that may add to the risk of injury during the assault, or including neckties, necklaces, because these may be used to cause injury. So there should be adequate caregiver training and availability of appropriate supervision, because this is critical in safeguarding the treatment of potentially dangerous patients. The caregiver should be encouraged to choose to present a few key observations in a calm and firm but respectful manner, putting space between self and patient, and also avoiding patient and verbal threats. False promises here may not be advisable, as patient may keep that and may cause aggression. So you can build a rapport with patients so that there is understanding. So for caregivers treating patients with a high risk of violent behavior, training in basic self-defense techniques and physical restraint techniques are useful. Okay, so now what will be some of the nursing interventions that can be taken? So nursing intervention can be thought of existing in a continuum otherwise, and they range from preventive strategies as self awareness, patient education, and assertiveness training to anticipatory strategies such as verbal and non-verbal communication and the use of medication. If the patient's behavior escalates despite these actions, the nurse may need to implement crisis management techniques. Okay, so in this containment of strategy, such as using seclusion or restraint. So, additionally, in trying to establish the risk for aggression behavior, it is important for the nurse to use a violence assessment tool, which is recommended in the units. Therapeutic nurse patient relationship to do with aggressive patient. The purpose of this therapeutic nurse relationship for an aggressive patient is to promote cooperation, trust, reduce anxiety, and also improve the misunderstanding that may exist. Okay, and you reduce the misunderstanding that may also exist. In turn, this will help in reducing aggression. Okay, then self awareness skills are also very important in assessing someone's self to help others. So, here the nurse can ensure the most effective use of self. Okay, it's important to know about personal stress that can interfere with one's ability to communicate with patients. So, in self awareness, you take care of anxiety, anger, tiredness, and apathy the patient may have so that you reduce on the aggression. You can also help the patient with personal work problems, and from part of the nurse, you can affect the patient. So, other negative counter transference reaction may lead to non therapeutic response on the part of the patient. So, this suffices to say that you don't force the patient to do what you want, but you help patient to do everything possible that will work in helping resolve the situation. So ongoing self-awareness and supervision can assist the nurse in ensuring that the patient needs. Okay, so patient meets personal needs, and also ensuring that patients are satisfied with the care. Of course, the patient is not existing as an island, so patient also needs education. Okay, about education that is appropriate. Patient needs to be allowed to express their anger. Okay, and also be taught on how best they can express their anger, so that they do not become aggressive on others. So teaching patients feelings are not right or wrong or good will allow them to explore feelings that may have bottled up, or that man might have been ignored or repressed, so that now they can come out on the things that have been affecting them, so that we establish what has even led to the aggression. The nurse can then work with patients on ways to express their feelings and evaluate whether the responses they select are adaptive or maladaptive. So, assertiveness training for this patient is important, okay, because the skill includes communicating directly with another person, saying no to unreasonable demands, and patients with few assertive skills can learn them in a structured group or program. Then communication strategy can also be taught to these patients in order to reduce on the possibility of aggressive behavior taking place as a result of poor communication. You can present a calm appearance and speak softly, speak in a non-provocative and non-judgmental manner, and you can show respect to the patient. Avoid intense direct eye contact and demonstrate control over the situation. Okay, do not make promises that you will not keep. Otherwise, if patient remembers, it becomes a problem. There are also what we call ward environment strategies, where this aggressive behavior is more effectively managed by allowing those at risk to spend time in their rooms away from the hectic, busy day, okay, rather than encouraging them to spend with the other patients, of which the risk of a fight coming or ensuing is very possible. So you can have a room program where once this has been done, the ward environment strategy has been implemented. So in the room environment, patients are asked to be in their rooms initially for a certain length of time, or conversely be allowed out of their rooms for a specific amount of time. So the amount of time in the meal may be increased by 15 minutes as patient tolerates the environment. When you talk about behavior strategy, includes limiting settings. It includes limit settings. Okay, and by limit setting, we mean telling the patient acceptable and unacceptable behavior, giving rationale for limit calmly and respectively to avoid the aggression, and then the limits that should be clarified before negative consequences of rewards are applied. And then the other one is being consistent in this approach. Okay, so now with that said, there are some behavioral contacts that can be done, acceptable behavior, unacceptable behavior, and also eliminate the rewards for the patient that receives if use violence or win control and make personal gains. So all those that show aggressive behavior, you can use reinforcement for only good things. Okay, so timeout in a inpatient getting the use of time can be effective tool for managing their agitative patient. So these are the patients that you have sent home, but they are still taking their drug. So in the timeout, it is a strategy that can decrease the need for seclusion and restraint. This can be done by removing the patient from overstimulating and sometimes reinforcing situations. Okay, token economy. In this intervention, acceptable behaviors such as interpersonal skills and self-care behaviors are rewarded with tokens. So guidelines should be made for desired behavior required to receive for the patient to receive tokens, and the number of tokens to be received for each behavior. Okay, on seclusion, what I can necessarily say is that involuntary confining of a person alone in a room from which the person is physically prevented from leaving, that is what we call seclusion. But the degree of seclusion varies. They include confining a person in a room with closed or unblocked door, or placing patient in a locked room with a mattress but no linen, and with limited opportunity for communication. You need to understand that seclusion will help the person from harming themselves and others. Okay, so we were looking at aggression in mental health. And in our definition of aggression, we said it is behavior that is intended to cause physical or emotional harm, and it is caused by either physical or verbal factors. We looked at the characteristics of aggressive behavior, okay, and then types of aggression, which was IRH, instrumental aggression, hostile aggression, and relational aggression. Thank you very much.